Hi guys, my name's Albert. This is my colleague John. We're two of the podiatrists here at Caulfield Community Health Service. We're here today to discuss your foot health and some good footwear. Hey John, so to kick us off, do you want to give us some tips on things that we should be doing on a regular basis to look after our feet and to make sure they're in good working condition?
Sure, Albert. So as podiatrists, we recommend patients have a daily routine to, inspect their feet. Things can include drying in between toes and having a look in between toes to see if there's any debris or any moisture that may have accumulated in there. We usually recommend people don't walk barefoot, even in their homes or outdoors, at risk of obviously stepping on foreign objects, which can, cause wounds and other things and lead to infections. Also, washing and drying well on a regular basis, and basically good foot hygiene.
Something else I'd like to add is the use of a daily moisturiser into your foot care regime. Unfortunately, as we age, our skin tends to dry out a little bit more, and so it's really important to get into the habit of using good quality moisturiser on a regular basis. As we age as well, there's other dermatological issues that can develop, and speaking to your podiatrist or general practitioner is a really good way to prescribe a specific emollient that you can use.
Another thing that I want to touch on is hosiery and socks. So a lot of our patients usually ask us what kinds of socks or what type of materials they should be wearing. Some of the traditional favourites like synthetic blends and pantyhose, for example, is something I tend to discourage the use of purely because the material is not as breathable as natural fibres. Yeah. So I think recommending something along the lines of a full 100% cotton sock or 100% wool sock is the way to go.
Okay, that's great advice, John. Socks, I think we can both agree on, is something that is quite often overlooked in many of our patients. One other thing I'd like to ask you is, and you would probably agree with me, a lot of the patients that come here into the clinic have quite a lot of swelling in their lower limbs and ankles, and I often find that socks can constrict their ankles and reduce blood supply to the feet. So is there anything that you could recommend or any advice you can provide for those patients?
That's right, Albert. We do see a lot of patients who do come to our clinic towards the end of the day where we see almost rings around their lower legs or ankles. And usually when socks are put on at the beginning of the day, legs are usually a bit thinner because we get a bit more fluid accumulating during the end of the day. Recommendations, we try to tell our patients to wear a more loose-fitting sock. Elastic-free socks, all-day socks are an option. There are also circular knit socks where there's no elastic at all, but the actual knit of the fibre holds the sock up on the foot. We obviously direct patients to independent living solution type establishments and pharmacies to further look for these products.
Great.
So Albert, we've spoken about foot health and foot care.
Mm-hmm.
We've spoken about socks, hosiery, which fibres to look for. One of the most important things and one of the most asked questions in our clinics is footwear. Yeah. What do we look for in a good shoe?
That's the $1 million question, and obviously as podiatrists we think footwear is really, really important. One of the top things on my list is fit. So quite often we'll see people present to the clinic with some really good shoes, sure, but they might be 2 sizes too big, they might be too tight, they might not accommodate the patient's deformity, whether it be a bunion or a hammer toe. So the first education I always give to my patients is to actually go into the retailer, try the shoe on, get professionally fitted to make sure that those things are accounted for. Okay, so in terms of footwear, John, we've got 3 shoes in front of us here that we both personally like and we recommend to our patients. Do you want to run our listeners through some of the ideal features of the shoe that they should be looking out for the next time they're in the market for a new pair of shoes?
Sure, Albert. So these are 3, quite good examples for quite different people. The main things to look for in footwear, when picking up a shoe is, again, making sure that the heel is nice and firm, so we don't want to be able to squeeze or push that down. So it's going to be quite firm. The next thing we look for is, the width of the shoe. So we actually want the width of the shoe to kind of mimic the width of our foot. So someone might have a much wider foot, which needs a wider shoe. So, for example, this shoe here would probably be sufficient for someone who has a more narrow foot as opposed to that one there. Again, they should have the same features, so they should all bend at the one place. And that's where the break of the foot is, or where the end of our toes are in the shoe. So again, the same thing should be done with this shoe as well. The next thing to look for, again, as we've spoken about, is the fastening mechanism. Again, my recommendation is Velcro. Shoelaces are also excellent, but again, for ease of fixation, I think Velcro is quite good. Things to avoid are buckles or clips, things along those lines, or anything with an elastic slip-on is something to be avoided.
Okay, thanks for that, John. One last question I'll ask you. When should one see a podiatrist?
Great question, Albert. There are many reasons why people come and visit podiatrists. There are those who have underlying medical conditions like diabetes or peripheral vascular disease, who are more likely of developing foot complications. So I guess they come and see a podiatrist quite regularly for ongoing care. There are people who are unable to look after their own toenail care or foot care. There are those who have corns, calluses which develop quite readily, and again, they need the services of a podiatrist. There are also the younger generation, young children, kids who have sporting injuries or things along those lines, ankle sprains. They might come and visit a podiatrist. So there are many reasons. Again, if there's an issue with someone's feet that they can't resolve or hasn't resolved on its own accord, then visiting a podiatrist is the next logical step. We hope you found this talk insightful and helpful. If you have any further questions or queries, feel free to contact your local podiatry provider.